vertical Labret or Labret, depending on who you talk to. Pros and cons, buy a piercer. Also going to cover what you should know beforehand, healing the piercing, getting the piercing, pain levels, all that stuff, living with the piercing, everything else you might need to know about this before you get one done. Coming up next on Pros and Cons by a Piercer, Season 2, Episode number 49. So you might want to stick around. For those that are new to the Body Piercing and Tattooing channel, welcome to the channel. Hope you're finding the videos helpful and useful and all that fun stuff, but you might not know who this character is. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So what we're going to talk about today is a vertical Labret or Labret, depending on who you talk to. This piercing is a oral piercing done through the lip, bottom lip, vertically, done with a curved barbell. I generally suggest piercing initially with a curved barbell. You can wear a ring in this, possibly a circular barbell, after it heals. Now, lip piercings have a long history of being a traditional piercing in various different indigenous people, especially those in Africa, South America, and even some in North America. As a modern piercing, it was developed in the 1980s and gained popularity through the 90s during modern piercings. Big, flu, kind of became more mainstream, I guess is the best way of putting that, where everything alternative became hip and cool. So let's go through the pros, the advantages, the things that make you go, yes, this is the piercing for me. Starting with number one. This piercing has a long history of healing. This is not experimental. This is not something that may or may not work or may have some issues. Usually these piercings heal fairly easily with little or no massive maintenance involved. The only thing they have kind of to their disadvantage is they can do a little bit of migration, but that's pretty rare. But for the most part, this is a pretty easy heal. Number two, this has less contact with gums, bones, and teeth than other piercings that are done in your mouth or out of the mouth. This one is prone to being less of a risk and doing less damage because it's more away from your teeth and gums. Number three, fairly quick healer. You're looking at probably anywhere from 2 to 4 months on healing with this one. Usually, once you get past that swelling point, pretty easy, smooth heal. Not very traumatic. Number four, does not impact sleeping as much as other facial piercings do. If you keep in mind, unless you sleep flat on your face, it's not going to have as many problems as, say, an ear piercing would do if you're a side sleeper, or even lip piercings that are off to the side. Since it's right in the center of your face and you generally don't smash your face into the pillow, it's a little easier to sleep with this starting out with. Final one, number five, can be done in groupings. This can be done in multiple other oral piercings to create kind of a pattern or a design that's unique to you. Before we move on to the cons, if you like this video, find it informative, find it useful, give us a thumbs up. If you'd like to see more of these, the best option is to subscribe, hit that notification bell so you're notified every single time we post something on the channel. Also, comment. If you have this piercing or you're interested in this piercing and maybe there's a question I didn't cover, go ahead and leave a comment. I generally answer them when I have time. Now let's move on to the cons, the disadvantages, the things that make you go, oh, man, I do not want to deal with that. That is definitely a no. Starting with number one, the risks involved with damage to teeth, gums, and etc. As I stated, this is a lower risk piercing, but there is always a possibility of it coming in contact with your front teeth, especially if you're one of those people that's constantly obsessed with playing with piercings, especially if they're close or in your mouth. That obsessive contact can cause issues. So there's always that risk, and pretty much if they start to happen, there's no way to reverse that. The only thing you do is limit the amount of damage. Number two, you're limited to rings or curved barbells or rings or circular jewelry. You can't put Labret studs in here. Straight barbells are not going to work well. It's basically you need that curvature, and you're kind of limited to that. However, it's kind of a half and half thing because there's a lot of different ends that you can get to put on that jewelry, either threadless or threaded. Though threaded is probably your best option with oral piercings, that you can get a very unique look to it. If you're using titanium, you get multiple colors, but you're stuck to the kind of that style of jewelry. You can't do the Labret studs and etc. Number 3, swelling. Yes, it's an oral piercing. It's going to swell. That's going to mean longer jewelry than needed at the beginning, some adaptation, some changes in how you eat, etc. It's going to be uncomfortable. Swelling is always a big part of any oral piercing, and you just need to understand that going in. Number 4, will impact eating and drinking. Now, this can happen even after the piercing is healed. I've also had some clients that say that being intimate, as in kissing, etc., can be really uncomfortable in some cases, depending on what you're doing, I guess. It's right in the center of your mouth, so drinking, eating, etc., will all be impacted by this piece of jewelry that's sitting there. You can limit that by the size of the jewelry and the shape of the ends, but it's always going to be a part of having this piercing. And the last one, number 5, this is not a piercing that you can leave out for extended period of times. They can close very quickly. It's really advisable to leave jewelry in it at all times. It's not one you can leave out for a couple of days, couple of weeks, couple of months, and not have issues getting it back in. Now, before I get 800 comments on the fact that they can leave it out for a long period of time, there is exceptions. There are people that if they have it long enough, for one reason or another, their body is just tolerant to the piercing and doesn't try to squeeze it shut and close it. If you like merch, you like t-shirts, you like swag, check out our merch store. A link is in the description. Now let's talk about what you should know or preparing for the piercing and getting it done. First off, you need to find a piercer that's experienced, professional, informative. It makes you feel comfortable. They should willingly give you a consultation, and we'll get into what should be into that here in a second. They should have experience with this piercing, and they should evaluate your anatomy and know what's going to work best for you. This should be done with a curved barbell initially. That is your best option. They should also inform you of the risks during the consultation to this piercing, like enamel erosion, gum erosion, softening the bones, changes in diet for the swelling, cross-contamination prevention, which is going to involve no oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks. Keeping your environment clean, clothing, bedding, towels, not submerging the piercing in bodies of water you can't control the quality of, washing your hands before you handle it, not sharing food items or utensils with other people, keeping pets away from the piercing, and making sure that they're not sleeping in the bed with you, especially smaller animals like to sleep up by your face, and basically just keeping things away from it. Also, making sure that the utensils that you're using, like forks, spoons, knives, etc., are cleaned on a regular basis. You should probably start with a fresh toothbrush, just to let you know that. Another thing that'll be mentioned in the conversation, the consultation, is diet change. You want to cut down your intake of tobacco, alcohol, cannabis, hot and spicy food, vaping, or anything that may agitate the mouth. Also, cutting down on salty drinks and foods will help reduce the amount of swelling you get. And I'll go further into swelling a little bit later. Lastly, check to see whether or not your piercer does supply aftercare products. With this one, the 3 major things you're going to need is a sterile saline spray, Biotin antiseptic mouthwash, an alcohol-free mouthwash that's an antiseptic, and also sea salt. Now, that's kind of an added thing, but it can help a little bit during the healing process. Talk to your piercer beforehand to see whether or not you can get all those items at their studio, or if you can buy it in advance and have the right stuff right on hand, and you don't have to deal with it day of. Another thing that's a good idea to do is stock up the fridge with foods that you can actually eat, which I'll get to later. There's a video that I did, and I'll try to remember to put it in the comments or, put a card up on how to prepare for an oral piercing. There's a lot of good information in there about diet, food, etc. Now let's talk about the piercing experience itself. The first thing they're going to do is they're going to do a consultation covering many of the things that are going to be involved with healing, the risks, checking out your anatomy, etc. Then they're going to select jewelry. At this point in time, they may measure the area to get an idea of what's going to be the proper fit for you using a caliper just to be on the safe side. Next, you fill out that waiver. This is going to involve things like health issues you may have, allergic reactions, anything, releasing them to do the piercing, of course, whether or not you're intoxicated, any other concerns the piercer may have about whether or not you're able to get this piercing done. It's always important to actually read the waiver, because there's usually a lot of information in there that maybe wasn't covered in the consultation that you should ask questions about. For example, if you have diabetes, whether or not that's going to affect whether or not this piercing is going to heal or not. So with that all done, they go ahead and set up all their tools, equipment, disinfect the tray, then set up everything and get ready to do the piercing itself. Next, they'll disinfect the area, usually with a surgical scrub, and then mark it. Now, when marking it, you want it straight up and down as possible and centered as possible. The thing is, measuring from both sides of your lip or your mouth may not present a definite center or what looks like a center. We tend to be a little odd from side to side. We're not perfectly symmetrical. So it's giving the appearance. When you're looking at that marking, I highly suggest that you look at it up close and then at arm's length, because arm length is going to give you a different perspective and let you see your whole face. It should fit into the face, not just into the lip or where the cupid bow is at the top. They should be guide points, but it should appear centered. And they should mark both the top and the bottom, and they usually are visible with your mouth closed. There are some piercers that do this freehand, but I prefer the good old-fashioned forceps. Clamp the area, lining up those dots. Then we inject a needle in and through. Once that's done, we remove the forceps. We'll use a guide pin, threaded one, and push the needle out with that. Then thread on the jewelry, push the jewelry in, and then thread on the end. We might use hemostats to put the jewelry in and hold it steady while we're screwing on that ball or what have you. But at that point in time, it's done. There might be some slight bleeding that we have to stop. But other than that, that's pretty much the whole procedure. Now, you may see more bleeding with this one than other piercings that you see, mainly because of the gap or the thinness of that guide pin. Because it's tapered, thinner on one side and fatter on the other side, sometimes we have to push it out far enough to get the jewelry on there that it kind of leaves a space in the piercing. Usually that bleeding, for one reason or another, always ends up inside the mouth, so you may need to rinse with like a mouthwash immediately afterwards. After the piercing is done, you'll usually have a little bit of throbbing, aching, maybe some warmth in the area in the piercing will be sensitive to the touch. Usually this lasts only about 10 or 15 minutes, but the sensitivity to touch will last up to about a week in many cases. Pain-wise, this one tends to be more uncomfortable than other oral piercings. We have a lot of nerves right there. Generally, we hit one of those nerve groupings or the general area, so it tends to be a little more sensitive than, say, a side lip piercing or even a Medusa or a beauty mark piercing. So just a tad bit more, not a huge amount, not something that you can't handle. Now let's talk about healing. Healing on this, average healing time is anywhere from 2 to 3 months, sometimes 4. Everybody heals at different rates. Sometimes it takes a little bit longer. During that time, I'm going to suggest that you clean it twice a day using a sterile saline spray, such as Nelmed's Piercing Aftercare. I like the fine mist type because you just spray it on there. If it's the wound wash that comes out in a stream, you probably want to do compresses. I also suggest rinsing a couple times a day, maybe at the beginning of the day and the end of the day, with Biotine Antiseptic Mouthwash for the first 2 weeks. Also doing warm saltwater rinses, 1/8 of a teaspoon per cup. Distilled water is your best option because it's usually free of microorganisms. Just kind of rinse with it off and on. It can usually kind of take some of the discomfort out of the situation and does help a little bit in healing. Now let's talk about swelling. It lasts anywhere from 3 to 5 days. It varies from person to person. During that initial piercing time, you want to reduce or stop your intake of tobacco, alcohol, cannabis, vaping, hot and spicy foods, and salty foods and drinks. All those things are going to lead to more swelling. Now, soft foods are best. Things that you can kind of you can swallow without chewing. The less movement you have and the easier it is to get in your mouth and down your gullet, the better off you're going to be. Cold items are fantastic. Things like smoothies, shakes, ice cream treats, stuff like that, pudding, baby food, applesauce, nutritional shakes, all that stuff is really great. Remember that a lot of this, once you get to that adaptation phase, once the swelling goes down, a lot of what your food items are going to be is more how you deliver the food or drink to your mouth. You may have to do it through the side or what have you. So get used to it. Take your time. It's always frustrating at first. Eventually, it'll become second nature. Also, to reduce swelling, cold items and stay hydrated, especially throughout the night, because you usually see the worst of the swelling first thing in the morning. Sleeping with your head above your heart will also reduce the amount of swelling you see. If you can sleep that way comfortably, fantastic. It's going to reduce the amount of swelling you see. Also, lastly, do limit the amount of movement the piercing has. If you're constantly playing with it or constantly talking, that movement, sliding through the piercing, and that agitation just will prolong the swelling and possibly lead to more swelling. Of course, I've kind of already covered this, but change your diet and how you drink to avoid contact with the piercing. You must practice cross-contamination prevention. We went through that before. Just to kind of go through it really quick. Clean your hands, no oral contact or sexual contact. Keep your environment clean, no swimming, keep pets away, keep utensils away or clean, and don't share them. Also, avoid sticking unclean objects in your mouth, like pen caps, toothpicks, etc. Covering this again, avoid excessive movement or playing with the piercing. That will always prolong your healing period. Now, first 3 to 5 days, you may notice a little bit of slight bleeding off and on. It's kind of rare, but it can happen. That is normal. There's going to be redness or discolorization around the piercing. That's normal. It's a reaction to the trauma of getting the piercing done. Also, it's going to be tender to the touch, and you may have some heat that's associated with the area. That usually fades too, along with the swelling. Now, lastly, you are going to want to downsize if that jewelry is too big once the swelling's gone down. Usually with these, I suggest roughly about 3 to 4 weeks into the healing process. If it's obsessively long, getting it changed during, as soon as possible. Sooner if it seems like it's moving a lot. Now let's talk about jewelry. Jewelry should be left in at all times. There's no reason to take jewelry in and out all the time. Piercings like to have that jewelry in there. It makes sure the piercing stays open, and changing the jewelry constantly can cause trauma. That's one of the reasons why most body piercing jewelry is designed to be in the body for a long period of time. Ends, if you have threaded jewelry, the ends of the jewelry need to be checked on a regular basis. Stick with ends that don't have sharp edges, points, or anything attached to them. That's just going to add another level of likelihood of trauma to the piercing by getting caught on things, damaging the tissue around it, and generally just being not fun. Basically a pain. If the jewelry is really loose fitting, it does need to be downsized if you haven't done that already once the piercing is healed. If you have a situation like a medical emergency or you're going in for surgery or a scan or something, they're saying you have to take the jewelry out. You keep the piercing open temporarily using a glass retainer. I don't suggest plastics and etc. I know a lot of people on the internet are going to tell you, oh, your plastics are fantastic. They reduce the likelihood of gum erosion. The reality is you're putting something in your body that you're unaware of what exactly it's made out of and may or may not be a health risk. So I generally do not suggest plastics, acrylics, and etc. Silicone, kind of the same thing, unless you have certification that it is biocompatible, which if you're going on, let's say Amazon, that stuff isn't. Now let's talk about living with a piercing. Check the ends on a regular basis. I know I was saying it a second time. Continue to avoid stress and contact on the jewelry and the piercing. Even a heel piercing can get damaged if it's caught or you're constantly playing with it or messing with it. It can cause them to migrate even. So stop playing with it. Leave it alone. It looks pretty the way it is. Leave jewelry in at all times. I always say that a lot, don't I? The other thing is practice safe sex whenever switching partners if you do oral sex. Because of the tissue softness and because it is in your mouth and it's in a location where it's probably going to have contact, You are more acceptable to STDs during oral sex. So if you switch partners, it means latex barriers until you've both been tested properly. Lastly, let's talk about abandoning the piercing. If the piercing is during the healing process and there's signs of infection or other problem, consult a piercer or a physician or medical professional before removing the jewelry. There's a reason for this. If it is in fact infected, how your body heals infections is by isolating the infected tissue and fluids and then slowly pushing it through the wound. If you remove the jewelry, which is the only thing keeping the wound open, the wound will tend to close. If that infection is deep in the piercing, your body has no way of getting rid of it, so it will form an abscess or a cyst and then slowly, painfully try to push it to the surface, and it probably will require medical treatment. If the piercing is completely healed or it looks healthy, even if it's healing, removing the jewelry will only cause the piercing to close. If it is completely healed and you remove the jewelry, just monitor the area. If you have any signs of problems, seek medical advice or the advice of your local piercer. Now, scarring-wise, it will leave an indentation scar over time. That should fade, but the reality is it's going to be there. When you take the jewelry out, what generally happens is your body squeezes together that tissue in the center and reconnects it and then fills it up from outward. So many times piercings will appear open long after they've been abandoned. It's just part of the process. Because it's on your face, they generally are a lot more noticeable than other piercings. Lastly, it's not uncommon to see sebum, which is a waxy, oily substance with a consistency of cream cheese, come out of abandoned piercing. It's something your body produces. It's completely natural. It smells awful, but it is not a sign of infection. Soap and water is really pretty much all you need to do. Well, I hope you learned a lot today about vertical Labret piercings, and you found this hopeful and useful. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and watch one of these other videos.